Hello everyone. In the last video, we had discussed about the importance of getting yourself vaccinated against cervical vaccine in the early ages of 9 to 15 years and even up till the age of 26 years. In this video, we will discuss about what if you have not got yourself vaccinated and now you're more than 26 years of age. What should you do now to protect yourself from cervical cancer? In this video, we will discuss about a few frequently asked questions which are asked by my patients regarding this topic. I am Dr. Shivani Garg, MD from PGI Chandigarh, and starting with the first frequently asked question, that is, what should I do to protect myself from cervical cancer now that I am more than 26 years and cannot get myself vaccinated? So the answer is that you should get yourself screened for cervical cancer, and by screening we mean that we have to do some particular tests to pick up the disease early and to start the treatment early. Then the next frequently asked question is that should I get myself screened even if I have no symptoms? So yes, you should go and get yourself screened even if you have no symptoms for cervical cancer, because there are many precancerous lesions, that is before actual cancer occurs. There are many such precancerous lesions which are asymptomatic and do not cause symptoms for many years up till cervical cancer grows and starts to show symptoms. So even if you have no symptoms, get yourself screened for cervical cancer. Then the next question is that should I get myself screened even if I have received the entire dose of cervical vaccine? So yes, in that case also you should get yourself screened at regular intervals, which we will discuss ahead. And that is because that cervical vaccines, they protect against few particular strains of the virus which causes cervical cancer and does not protect against the other strains of virus which cause the cancer. So to get yourself screened, to protect yourself from the other strains of HPV virus, you have to get yourself screened regularly. And coming on to the next frequently asked question, which is that how should I get myself screened? So for that, you have to visit your gynecologist and you have to ask for a very basic test which is called as a pap smear, and the test takes only 5 minutes to be done, and procedure is not much painful. The result of the test comes within 2 to 5 days depending upon the laboratory in which it is sent, and depending upon the report of this test, the further management and treatment can be done accordingly. Then coming on to the next question, that how frequently will I have to get myself screened? So for that, if you are getting a pap smear test done, then you have to and your test report is normal, then you have to get it done every 3 years. And there is another test which is done along with an HPV test, along with a pap smear test, which is called as a HPV DNA test done. So this test we generally advise the patients who are more than 30 years of age and want to get themselves screened for cervical cancer. So in that case we do a pap smear test done along with a HPV DNA test done. So if you've got the two tests done together, then you have to get yourself screened at the interval of 5 years. Then and that is if the report every 5 years is normal. Then coming on to the next frequently asked question, till what age will I have to keep myself getting screened? So you have to get yourself screened up till the age of 65 years, and that is if the result of the previous 3 to 5 yearly done tests were normal. And now if you are more than 65 years and you have not got yourself tested or screened at all, then yes, you should go and get yourself tested for cervical cancer by getting a pap smear test done right away. Then one important question is that what are the symptoms of cervical cancer? So the symptoms are irregular bleeding, excessive bleeding, abnormal vaginal discharge, foul smelling vaginal discharge, excessive vaginal discharge, and bleeding after sexual intercourse. So these are a few symptoms which cervical cancer can cause, and if you are experiencing such symptoms, then you must visit your gynecologist. So I would urge everyone to spread this awareness of getting yourself screened. Each one of you who is more than 21 years of age, irrespective of the fact that you are vaccinated, you should get yourself screened regularly for cervical cancer, so that it is picked up early, and if it is picked early, it can be treated very easily. But if it progresses, then the treatment becomes difficult. So thank you everybody for watching this video.